Throughout the period of our investigation into what was happening at Dunedin Hospital, senior staff members of the Southern DHB have made themselves available to Checkpoint to be interviewed. It was on Checkpoint the DHB first publicly announced the review of urology was underway. That was during an interview with Chris Fleming, the DHB CEO, a fortnight or so ago. And just before we came on air, Chris Fleming joined us again to discuss the review and its key findings and recommendations.
Including making sure that we've got the right resourcing within the two locations, addressing some critical facility-related issues, and also looking at processes and practices that will improve the flow.
Can I ask you some specific questions
Sure.
relating to the review? Thank you. Discussion of key observations. Point B, serious clinical events have already occurred and will continue to occur. Can you tell me what they are?
Well, look, the mere fact that, as you know, there are 11 patients that have been waiting longer than the expected time for significant procedures in terms of the radical prostatectomies. Any delays can create problems in terms of ongoing care.
Did those delays create problems in terms of ongoing care in some cases?
Look, what I'm told is where a patient with a malignant condition such as prostate cancer has delays in making diagnosis and in reaching definitive treatment, there is undoubtedly a risk of progression of the cancer. This may not present initially, and it may be some time later that's understood, perhaps years after the treatment.
So has this put patient well-being, health, at risk?
It does put patient health and well-being at risk, and we just need to do much better.
You do?
Yes.
It says, key observations, number 2, there is a significant level of clinical risk within the long-waiting patients at the Dunedin site. Is that good enough?
No, it's not good enough, and do I agree with it? Yes, I do.
What was the longest wait, Chris, of those 11?
The longest wait is 191 days.
So what's that, 6 and a bit months?
Yes, completely unacceptable.
After diagnosis, after cancer diagnosis?
Yes.
So why has this been allowed to happen?
Well, I think the review document sets out many of the issues, including the serious difficulties associated with the relationships within, particularly Dunedin. It makes comments about the strained relationships between the urologists and senior management on the Dunedin site, but it also articulates the fact that the two services have run completely separately.
I want to pick you up on the relationships, because when the Minister came on Checkpoint, he called the department toxic. Was that fair?
There's been a lot of talk about the word toxic, and I'm going to clarify things for you and also for the public. I indeed talked about a toxic culture within Southern DHB relating to this issue.
Right, so did the Minister get that word from you?
The Minister got the word that I said that it was a toxic culture. That is not, however, to be confused with individuals. We have some great urologists and we've had great managers working within the environment, but it has created problems that have put patients at risk that cannot move forward.
Isn't it a response to the fact that patients are at risk? I'm going to read from the report. Clinicians in Dunedin all express frustration and anger because they feel they are not listened to and that they have been misled. What is toxic, actually, is that you have clinicians who give a damn about their patients, who haven't, as you have already admitted in this interview, and as the report is explicitly clear on, been able to treat people as quickly as they want, who have been saying to their managers, this isn't good enough.
I agree, but however, I would point out relationships require significant effort from all involved.
So when the Minister came on Checkpoint and repeated you by using the word toxic, actually what he was doing was casting aspersions against a group of clinicians who were lobbying managers really hard to do better for their patients, wasn't he?
No. Well, can I just finish? The urologists have indeed reported that a significant contributory factor to the whole situation was a lack of confidence that the issues they were raising were being addressed. The senior management the senior management involved, who coincidentally no longer worked for Southern DHB, had, however, indicated concerns over the way the service was operating, which they were struggling to get engagement to. And so the situation should not have got to that position. We should have all done something different. And the thing that I am pleased about is the work over the last couple of weeks. I've met personally with all the urologists that we on both Dunedin and the Invercargill site, and we've committed to the accepting the report, all the recommendations, and we've committed to implementing all of the recommendations as quickly as we can.
And if we look at the implementations and the recommendations, urgency is required in the area of outpatient staff deployments, risk management, a clinical nurse specialist. You only have one full-time equivalent position. The review committee believes that is inadequate. Service changes cannot wait for the Dunedin facilities to be rebuilt. You only have inadequate time. The theatre, the review says, a lot of money needs to be spent quickly, doesn't it? Are you going to do that?
Look, what I have committed to implementing all the recommendations, including the resourcing issues.
When?
Addressing the facility issues, which some will be able to be addressed immediately within the existing challenging facilities. Some others will need to take longer term with the rebuild.
How much longer? So the rebuild is what, 5 to 7 years away?
Yeah, but as I said, some of the facility issues, such as I went and visited, there is a infamous flow room.
That's right.
And I went and visited it. It needs to be addressed, and it needs to be addressed as quickly as we can, not wait till the redevelopment.
Right. In fact, as I recall, it's described as smelling bad, as being almost impossible to use, and very difficult for some people even to access it, right?
I am not going to defend that, because that is exactly what it is.
But what the review also says, and we're talking about substantive changes, and I know that you were stuck between a rock and a hard place, and you're probably not going to say that. But above you, you have a commissioner appointed by the minister after he sacked the boards to make cost cutting, to cut costs down there, right, to reduce the deficit. You need to spend money. You have a rebuild that is some time away. But if we look at what the report is saying, it says, and I quote, service changes cannot wait for the Dunedin facilities rebuild, as that is at least 5 to 7 years away. Now, you've just told me you're going to implement the recommendations of the report, but you've also told me you can't do so until the rebuild. The report says that's too long. You're
making 1 plus 1 equals 3. We, as I said, we are committed to implementing the resourcing issues, which we will get on to just as quickly as we can, and I will talk about timeframes shortly. We're going to address the facility issues we can, and we are going to look at improvements in processes and practices that were also identified within the review. What we've asked for is one of the reviewers to come back immediately and develop an implementation action plan with management and the urologists involved. And we're also going to have that implementation action plan independently peer-reviewed to make sure we're stretching ourselves as far and as fast as we can. The commissioner team have the report. They have identified and tasked me with implementing all of the recommendations. And when you get to some of the tougher issues, for example, the theatre capacity, we are having to critically look at what can we do, because we cannot wait 5 to 7 to 10 years for the new hospital. We are going to have to find interim solutions, which will include working with our private providers, but it will also look at, can we expand capacity within the environment we're in.
It's Chris Fleming, CEO of the Southern DHB. The Health Minister, Jonathan Coleman, declined to be interviewed. In a statement, he says the DHB now has a path ahead to ensure its urology services are brought up to standard. We'd love your feedback on this. You can text us 2101. You can email us checkpoint@radionz.co.nz. And of course, we are on Twitter.